So hi, this is Mary Curick of Front Runners Innovate magazine. And if you've been following us along, you know that we like to drop in features with influencers and advocates and leaders in the fields that relate directly to what we're doing in the magazine, which is promoting innovators in particular spaces. The edition we're working on right now is women's health and maternal health. And so it just made me reach out and connect with who we've got here, which is Lisa Hertz. And Lisa is with the Women's Global Health Innovation Organization out of Canada. And so thank you, Lisa, for joining us and having a chat with us about what you guys do. So as I told you, what I like to do is start with a little bit of background. So give us a little bit of your personal history that led you to what you're doing now.
Yeah, absolutely. Mary, thank you for this opportunity to present, what we do here at Women's Global Health Innovations.
Yeah.
What led me to the work that we're doing in regard to menstrual, sexual, and reproductive health globally is, I think it found me as opposed to me finding it.
And that's the best way things happen.
It's the best way. For years, I would come from a science background. I worked in healthcare and sort of, close to public health. And then I moved into the design arena because I had a creative artistic bent. And those two coming together along with kind of a lifelong passion for adolescents and the struggles that adolescents have, and innovation in women's health, adolescent girls and women's health, in particular menstrual health. You're using tampons, you're using pads, and it was kind of like, can we get something better?
Yeah.
And and then I learned about menstrual cups. I'd been looking at them, and I'm a lover of material science, and I said, we can do this better. We can do this better. So there's where the seed was, because I was doing research and different technologies and fell upon a particular technology that I thought, let's give this a try. So it's comes all the way through. I came into this later in life as well. I was, well into my 40s, but I'd already been in product development, but it was just like, I've got to do something for adolescent girls and women in regard to menstruation, because it's just not being done well enough, in the women's health sector, especially, in the global scale. And when you start looking at
it, and I think we almost have to drill down on that point for people who are watching this. We're seen in 160 different countries. So we hit some of those countries you're talking about. And for a lot of people, they don't understand, for women in some of these marginalized countries, they just don't even have products. Right. Some of the women that are the young girls that come of age to have their menstruation happen, maybe going to school. And so it's you're dirty, you're unclean, you're unsanitary, and so therefore you're not allowed to be in school. So it's a real problem from a lot of perspectives, not just the product, but honestly, getting at least something in the hands of other people is good. So while we're looking at it as we just need something better, we not only just need something better for ourselves as when we need it for, to try to help out these other, struggling countries as well, and get that advocacy piece in there about looking after them, So good for you. That's great. So you're an innovator and mind and heart too, I can tell, because you were already thinking about what you could do to change. So tell me about the evolution of the organization. I mean, when did it start? How did you come on board? The mission, therefore.
Yeah, no, Women's Global Health Innovations, I had incorporated it back in 2013, so we're now 7 years.
Mm-hmm.
And I knew right from the get-go, as soon as the idea came, it was just like, I had tried other ventures in the past, so, not that I'm much of a serial entrepreneur, but definitely had some other products that actually went to market. So I had that experience, so I had the foundation of, what it takes to manufacture a product and get it to market. And, most people out there, don't know the complexities of, it's to have an idea, but then to go through
complicated.
How do you, sourcing your materials and then building your molds and, finding the right person to manufacture. Are you going to China? Are you going to make something you're going to manufacture in Canada or the United States? And all of those bring about like complex questions and answers, and in regard to quality assurance and whatnot. So Women's Global Health Innovations was like at the very beginning of, we have the idea for an innovative product, and this is actually our product here. It's called a Bee-Free Cup. So it's a menstrual cup, but it's antibacterial. So it's the world's first physically antibacterial menstrual cup. It doesn't have any chemicals in it, doesn't have any microbicides. It's actually physical. So it's actually the texture that prevents a biofilm from forming, therefore bacteria can't adhere. So you were talking about the marginalized communities around the world, the girls, the adolescents that are like relying on everything from cow dung, dried cow dung to collect their menses.
Mm-hmm.
This whole gamut of challenges that that prevent them from showing up at school, or and the embarrassment, the stigma around menstruation, the taboos around menstruation. So with a product like this, you're thinking, okay, how does it work? And then you think it's got to be it's worn internally, like it's worn in the vagina. But at any one time, from a marketing point of view, at any one time, there's 800 million girls or women around the world menstruating. 800 million women and girls that need something to help them to manage their period with dignity. And dignity is a human right. So accessing a pad that you're buying every single month is really challenging. Like some girls engage in what's called transactional sex to afford pads. Some of them are just using old mattress stuffing, or they're using old socks, or they're sitting in the sand for a couple of days for the sand to absorb their menstrual fluid. So, and that doesn't even bring into, they don't have, pit latrines, or they don't have toilets. The sanitation system is not built, it's not female friendly. Accessing water, accessing the wood to burn the fire, to make the fire, to boil the water, to boil a traditional cup, because menstrual cups need to be boiled. Traditional menstrual cups need to be boiled because they're not antibacterial. So that's where the idea came from, the connections of what I knew, what research was out there, what science was out there, what material research that was happening at MIT, at Harvard, as well as at ESPCI, a research institute in Paris. So I knew that this research was out there, it just hadn't been applied to silicone before. So we did, we got proof of concept very early on, like in about 2014. And then it starts the design process and the manufacturing and the molds and the fundraising and the, at this point, we have funded it through grants through the Government of Canada, through Grand Challenges Canada, through a grant from, actually it was a competition with UNFPA, the UN Population Fund, which we got narrowed down to 4 of us out of 270. And that is all in regard to innovating products that are easy to access, affordable, safe, high quality, and reusable, because the environment is a big part of, the conversation today has to involve, also has to do with the environment. So that's where the Bee-Free Cup came in. It is the only one that doesn't need to be boiled. So girls that are living in slums in Kenya, or somebody who's living in an Indigenous community in Canada who has difficulty accessing water, it makes it so much easier so they don't have to boil. And the embarrassment of boiling your menstrual cup in front of your family, we're not that open in regard to talking about menstruation yet. That's happening. But that's why Women's Global Health Innovations exists, and this is what the basis of. So we do have thousands of young girls and women around the world using the cup already, a lot in the US. Thank you, US. Thank you, FDA. And we're getting, wonderful reviews. And
this is not something that has to be prescribed or anything. This is something they can get how?
Over the counter or through our e-commerce. Menstrual cups, they're not, in Canada and the United States, it is considered a medical device, a class 2 medical device. In Europe, it's a consumer product. So it depends on where you are, which country. You have to go through whatever country approvals of whatever country, however they classify the menstrual cup. So in the US, it has to go through, be registered with the FDA, which we are. It's quite interesting. I think the largest market actually is the United States. So just to give you some numbers right now, it's already at about $1 billion in sales annually and
Wow.
globally with a cumulative annual rate of growth of around 5 to 7%, depending on which market report you're looking at.
Fantastic.
Yeah.
How
So
great is it to get away from the expensive other products that this is replacing?
right.
Yeah, and then just I mean, is there a life expectancy on these things? So
Well, some companies say 3 years, others say 5, some say 8. We kind of say around 10 years. But just on the inside, we did, from a marketing point of view, it's kind of like, but if you're only buying it once every 10 years, what's the business? But there are girls that are born every day.
yeah,
And I can tell you that with different colors and different sizes and different, it's just like women. I want an orange one, I want a tangerine, I want a black one, I want a purple one.
yeah,
We did testing on it because we are very much evidence-based, research-based.
yeah.
And we stopped at 120 years.
Wow.
Yeah. So the longevity is definitely up there. Most, change their cup every year, every 2 years, kind of,
Yeah.
humans get bored. Humans get bored. I'm tired of my tangerine cup. I think I'm going to go for a fuchsia next
And
time.
everybody says it's comfortable.
Absolutely.
Yeah.
Depending on, sometimes, and of course, every woman, her anatomy is unique.
Yeah.
Some have a cervix that sits higher in the vagina,
Uh-huh.
some have a low. So depending on that, you can go with a lower volume cup
Yeah. Okay.
or, a higher volume. And again, depending on your flow.
Your flow.
Now, in educating, on our website that we www.befreecup.com, on our website, there's questionnaires in regard to, is your flow heavy? Do you have a high cervix? And we teach how to determine that. You do not feel a menstrual cup the same as you do not feel a tampon unless you've really pushed it up there and it's in contact with your cervix, which is quite, a bit of a sensitive area. So it's meant to sit sort of in the middle between the cervix and the exterior. And you don't feel it. And you can leave it in for up to 12 hours. So a young girl going to school, she can be in school all day long and she doesn't have to worry about emptying her cup until she gets home, in the comfort of her own bathroom. So yeah, 120 years. It's something that you can leave in your will to your grandchildren.
And then 120 years from now, they're going to look at that and go, what?
Yeah. Other innovative, innovations that,
Well, I have kind of a different question for you in relation to this. Do you see any application for after childbirth? When there's some bleeding there, or what do you think?
In regard to that, we generally want the woman to give herself a rest
Mm-hmm.
as well. It can, I don't say that you cannot. I would say that you probably need a higher volume cup.
Sure.
And it
Mm-hmm.
depends on your comfort level. So this is antibacterial, but it's one of those
Yeah.
things, depending on how easy or how difficult the birthing
Processes. Yeah.
No,
Okay.
and that's so it's all,
Yeah.
some people have, labor 1 minute and 20 minutes later the baby is, sitting in the cradle. And that's
Yeah, I know. Well, I guess I was thinking about a lot of the marginalized countries or whatever, and how so many women there, even though they have several children, a lot of them, there's a lot of, infant death, and even mortality amongst the mothers from bleeding out and that sort of thing. And I know that's really a medical condition that the doctor has to check into. But in those countries where they really can't get product enough to take care of some of those things, perhaps post surgeries or post, babies or whatever, that could be, something to check into. But
yeah, no, I mean, oxytocin and, those kinds of drugs, if there is a bleed out, which is of course very serious,
mhm.
high incidence of
Well, and high risk of bacterial
COVID,
infection and stuff, for that too. So
chlorhexidine, for the baby. And
yeah.
there are birthing kits that are available through, USAID.
Mhm.
And those are definitely decreasing the infant mortalities. So that you're putting chlorhexidine around the umbilical cord. And the mothers, in regard to bleed out, COVID-19, a perfect example of where there is a higher incidence of maternal mortality and infant mortality related to COVID-19, which is so unfortunate. And where you're seeing a lot of that is in adolescent pregnancies.
Mm.
And that comes back to, why are girls getting pregnant? You know, the incidence of HIV in adolescent girls in sub-Saharan Africa, I hear is like, you know, 7,500 new cases a week in adolescent girls. So, and why? Like, what, you know, you go back upstream, pardon the expression, but you go back, like, what's going on here? And you know, part of that is transactional sex, again, to afford menstrual pads, part of it menstrual pads or school fees, or, you know, these things that if you catch it earlier with education and knowledge and support, that, you know, and with products.
I was just going to say with product. Yeah.
Yeah, product that really, you know, help them stay in school. And I have to say that the Kenyan government, the Ugandan governments, like, they really now are very focused on menstrual health, as well as a lot of the UN organizations, that they do see, you know, there was, you know, sexual and reproductive health. And even though menstruation is part of reproduction, because of kind of political sensitivities around sexual and reproductive health, menstruation was getting kind of ignored as well. And it was just like, no, let's keep this as its own entity because it's so vital. We're talking girls between the ages of 9 and 12, you know, starting their period, having, you know, experiencing menarche, many of them not even knowing what's happening. And I can tell you that one young girl that we had a program in Uganda, a project just recently that was the one that was supported by the UN Population Fund. And this young girl, we gave them an opportunity to stand up and tell their stories. And this one young girl stood up and told us that, you know, it was just like a year or so ago that she had started her period the first time. She thought she had Ebola. Yeah, scary stuff. Like, she went to her parent, her mother, and her sister to say, like, she was apologizing for getting sick and saying, you know, I'm going to die and my apologies for, you know, however I got sick. And it was just like, she thought she had Ebola. And the shock of that to me was just like, because of course Uganda is very close to the Democratic Republic of Congo, like, they're pretty close to the border there. So she thought somehow, you know, she contracted this, and but it was her first menstrual period. So the impact of not knowing, like, what to expect, not having any body literacy, understanding. And most think that, you know, the blood is coming from, not from the uterus, but from the urethra, like that you're peeing blood, you know. So, you know, coming in and bringing the knowledge first, even, you know, beforehand, before it happens, you know, so that you can have some, you know, it's just like, I'm dying, you know, so many.
There's actually some young ladies in the United States that feel that way too. I know, I've heard the story.
It is definitely global, you know, and in regard to our sensitivities and in regard to comprehensive sexual education, I think maybe the name could change, because it's talking about healthcare, like sexual health, not the act of, you know, but it's so important for both girls and boys. And we teach the boys as well. So it's very much on a gender equality. And the boys learn about menstruation. The girls learn about what the boys are going through gender, through puberty.